I'm going to do a very short presentation on ICD 9 to ICD 10 migration, reasons and benefits. The reason for why we chose this topic is because the migration from ICD 9 to ICD 10 is currently a huge issue in most of the developed countries and also among some of the developing countries where the health IT is active and insurance sector is becoming bigger and ICD is required to code the diagnosis and ICD-9, which was being used for last 30 years, has now become obsolete and people have started using ICD-10. And as we all know that whenever a new version of any particular software or any particular thing comes, there is a certain amount of change management required, there's a certain amount of anxiety, there's a certain amount of effort and investment needed. And a lot of hospitals are questioning this investment and it's inconvenient to them. ICD 9 to ICD 10 migration is not very smooth and easy. So, the intent of excuse me, this presentation is to shortly introduce all of you to what was ICD 9 and its deficiencies, and why is it beneficial to move to ICD 10. And by the end of this presentation, you will be a little more familiar with both of them. We are going to cover what is ICD, who makes it, what are the uses of ICD, what is ICD 9 and ICD 10, and why should one move to ICD 10. Then we'll just see a short comparison between ICD 9 and 10 and a few examples. So the intent is to familiarize you, and then if you have any particular questions or any particular practical problems, you can ask us right now or you can contact us offline for any kind of help that you need regarding this. So what is ICD? ICD stands for International Classification of Disease. That is the full form of ICD. It has become the international standard diagnostic classification. So it is a kind of a catalog, a kind of a code. So it has become the international standard diagnostic classification. All the diseases, when somebody is diagnosed in a particular disease can be coded in a certain code which is same across the world. The importance of this thing is that in various countries, in various languages, the same disease is given different names. And if a patient is moving from one country to another, or an organization like WHO is trying to compare statistics, they cannot easily compare between same diseases unless it has been coded in a uniform pattern. And that is where the importance of ICD comes in. ICD 10 represents International Statistical Classification of Diseases and Related Health Problems. So ICD 10 has a slightly broader scope than ICD 9, and therefore ICD 10 can be used to classify data recorded under headings such as diagnosis, reason for admission, conditions treated, and reason for consultation. Now here is the big difference, that initially the classification had been designed only for classification of a disease, but there was no allied information that could come along with it. But now with the expansion of scope of ICD, there is certain additional information that can also be coded, which has got both the importance from the perspective of statistical analysis as well as from the perspective of doing a pattern study and insurance reimbursements. So who makes ICD? Now ICD was made by WHO. So that is the World Health Organization, and they released it. They usually, you will also find certain modifications of ICD, and you will find ICD 9CM, ICD 10CM. CM stands for clinical modification. Most of the ICD 9CM was done in US, and it was a kind of localized modification for the country. Some other countries also release their country or region specific ICD based on WHO's release. So if you see ICD AU, it belongs to Australia. If you see ICD D, this is Germany. So there are certain variations, but the variations are usually in the name of the disease, and it is not in the codes itself. So the codes remain consistent world over. What are the uses of ICD? So I am putting up here the standard official definition. The purpose of the ICD is to permit the systematic recording, analysis, interpretation, and comparison of mortality and morbidity data collected in different countries or areas and at different times. So I'm sure some of you have a medical background and understand all these terms like mortality and morbidity. For those who are not from the medical background, mortality usually refers to death and death rates, while morbidity refers to disease and a morbid state of the body. So it actually collects data both of death as well as disease. So it's pretty clear here that the intent was to record, analyze, and interpret the data from various countries and then compare it. And of course, at different times, so that we can find the past patterns to take preventive actions in the future. Another thing which was not possibly so much thought for by WHO, but it has been used is by the insurance, that is the health insurance companies. So the health insurance companies, when they receive a health claim, they insist that a diagnosis be coded in the ICD. Of course, there are country-wide variations and there are some derivative codes of ICD, like DRG is a disease-related grouping code, which is based on groups of ICD codes. But at the same time, most of the insurance companies require the diagnosis to be coded in ICD format. And this is where the commercial reasons have come up. When WHO released it, the whole intent was non-commercial in nature. It was for the sake of healthcare. But once the insurance companies come in and claims will get rejected if it is not coded properly in ICD, there is a very definite commercial angle to this as well now. Now, what is ICD 9 and what is ICD 10? What is the difference? The difference of version of release. The ICD-10 is the current version, although most of the world is still using ICD-9 versions and its variations. Now in USA, under all the changes in the healthcare which have come after the ARA High-Tech Act, another one is to move to ICD-10 by the end of this year. There has been some relaxation in this of late, but that is what the country is moving to, and it's in a very definite way. And we must all realize that US healthcare is currently the world leader in healthcare, and therefore all the patterns of US healthcare are usually copied to some or the other extent. So most of the other countries will sooner or later have to migrate to ICD-10. The benefit for developing countries here is, and I am typically talking about certain Southeast Asian countries, where the history of ICD-9 has not been very long. So we have been coding diseases in ICD-9, but electronic systems have not been around for a long while, and they are still not very popular. So in such a situation, it is easier for the developing countries who have not already committed last 30-40 years of data into ICD-9 in an electronic format. It is easier for them to straight away adopt ICD-10. But for the countries who have been using electronic format recording and it is an ICD-9, there is a certain expense of both investment and effort to move from ICD-9 to ICD-10. So why should one move to ICD-10 at all? Can we not stay and stick to ICD-9? The transition to ICD-10 is occurring because ICD-9 produces limited data about patients' medical conditions and the inpatient procedures. So earlier we had lesser procedures and we were capturing lesser info. Now the procedures are more, we are able to analyze more, so we also need more information to analyze. ICD-9-CM was developed over 30 years ago, and the codes do not accurately describe diagnoses at the necessary level of detail. Second thing is ICD-9-CM has now run out of numbers to assign new diagnoses. As the investigative modalities are improving day by day, more and more diagnoses are coming up. And ICD-9-CM now, as per their numbering protocol, they have run out of numbers to assign new diagnoses. So where will the new diseases go? Most countries have already moved to ICD-10 coding in the sense of the spirit, but not in the sense of the practical work. Most of the governments support it and they have asked the hospitals and the healthcare systems to move. The ground reality is still that ICD-9 is very extensively used, but once the government mandate comes in a particular country that they have to move to ICD-10, and there is a necessary movement towards that, and usually there is a timeline as well. So sooner or later, everybody will have to start using ICD-10. ICD-9 systems used in the US cannot accurately capture diagnosis statistics, and this causes potential problem in identifying and tracking new worldwide health threats. So there's a lot of dependence. Now, I'm sure you all heard of these pandemics which are occurring in the world. Latest one, we have been hearing about an Ebola virus outbreak. But before that, we have heard about SARS, which is a respiratory syndrome. We all have heard about H1N1, H1N1 virus. So, considering all these outbreaks which happen, unless the diagnosis is properly coded along with the allied information, there is no possibility of doing a correct statistical analysis and then taking preventive action. So, unless accurate coding is done and it is done in the standardized way across all countries, there will be difficulties across the world in controlling diseases, controlling epidemics, which will then go out of control. So, while one may think that simply logging all the diseases in ICD-10 is just an academic exercise, a medical record, or in the file, it actually has long-term and serious ramifications. Now, in this slide, we'll compare ICD-9 and ICD-10. So, if you see on the left side, I have written the characteristics of ICD-9-CM. ICD-9-CM is typically 3 to 5 characters in length, while ICD-10-CM is 3 to 7 characters. Now, when we say 3 to 5 and 3 to 7, it means the lower limit of the characters to describe a particular disease stays the same, which is 3, but the upper limit from 5 characters has gone to 7 characters in 10-CM. So, obviously, we can see that more data is being captured. Now, in ICD-9, the first character is numeric or alpha. In case of alpha means alphabetical. In case of alpha, it is only E or V as the first character. While in ICD-10-CM, we can actually use almost any character except U. I'll come to that later. The characters number 2 to 5 are numeric, while in ICD-10, characters number 2 to 7 can be either alphabetical or numeric depending on the kind of description they are capturing. But in both ICD-9 and with at least 3 characters. There is a use of decimal after 3 characters, but by the virtue that there are 5 characters at most in ICD-9 and 7 in ICD-10, the total number of codes in ICD-9 are just about 13,000, while it goes up to 68,000 in ICD-10-CM. Now, this does not mean that earlier in the world there were only 13,000 diseases and now we have 68,000 diseases. The number of diseases have definitely gone up, but not that significantly. But what you can see is that in different codes, we are capturing more and more information about the disease. Now, continuing all this comparison between 9 and 10, approximately 70% of all ICD-9 code one-to-one match with an ICD-10 code. So this means that if there is a specific code given to a disease in ICD-9 and a hospital wants to move to ICD-10, there is a straight conversion from ICD-9 code to ICD-10 code without any difficulty for roughly 70% of diseases. The National Center for Health Statistics have developed what is known as General Equivalence Mappings, or GEMS. This is a piece of software. If you can Google it, GEMS and ICD-10, and you will be able to find it. It is completely free of cost, available on the internet. And if you put in any particular ICD-9 code, it will be able to give you the ICD-10 code for that, and vice versa. So the CMS developed GEMS for procedure codes also. Procedure codes are specific in US. GEMS are considered to be authoritative source for crosswalking between ICD-10 and ICD-9. So here the importance is that if a patient is a long-term patient, let's say a chronic disease patient who has been with the particular hospital or a doctor for last 5 years, his first disease codification was done in ICD-9. But now as the patient continues to receive treatment, while the diagnosis remains the same, the ICD code changes as the adoption of ICD-10 happens. But at the same time, the hospital cannot change the code retrospectively. So in the older records, the previous ICD code will be maintained, while in the newer records, the newer ICD code will have to be done. And somewhere the system has to understand that they both are same. So there is a file for mapping ICD-10 to ICD-9 and a file for mapping ICD-9 to ICD-10. So both ways a mapping can be done. This is usually called a forward mapping and a backward mapping. Now you must have noticed that I have mentioned that it's approximately 70% of codes which have a one-to-one match. So what about the remaining codes? Let me show you the structure of ICD-9 and ICD-10. So ICD-9 CM codes are 3 to 5 digits. So if we see this particular box, which is the top box, what you are seeing is a 5-digit code. And as we discussed, 5-digit code is an ICD code. So the first character of the code is numeric or alpha. So it can be either E or V as we discussed. Then the next two will be numeric, and then there will be a dot, and then there will be two more characters. Now what do they represent? The first three overall, they form the category of the disease. So the before the dot, whatever the code is, it is a category of the disease. And after the dot, there is some kind of description about the disease, which can be about the category, it can be about the anatomic site, it can be about the severity of the disease. But if we see below the ICD-10 CM code, what we are seeing here is that first one is always alphabetical. Now the first one is alphabetical except the letter U, and the letter U has been reserved for those newer diagnoses which come up in future. So all those ones which have not been accounted for today and cannot be accommodated, they will be in future accommodated under the letter U. The second digit is always numeric, and the remaining 5 digits can be of any combination. But what are we seeing here? Now just like ICD-9, the first three characters will represent the category. So before the dot, this is the similarity. Before the dot, whatever has been described, it is the category of the disease. After the dot, there is further description. So after that, you could see only two characters in 9, while in 10, after the dot, you will see three characters which are describing the category, anatomic site, and severity. And then there is a fourth one which describes the extension. Now, this may look a little confusing here, but we'll see an example soon in which you will be able to appreciate the difference. So let us see this particular example. The disease for which we are going to code here is called chronic gout due to renal impairment, left shoulder, without tophus. So this is a long description for a disease. So those of you who do not have a medical background, chronic gout is an somewhat similar to an arthritis kind of a disease. This disease is happening to this patient in the left shoulder. He has got renal impairment. Renal is kidney. So the patient has, and tophus is a kind of a deposit which is happening in the shoulder joint. So there are four things which have been described in this diagnosis. Now let us see in ICD-10 how does it capture. So the first three characters, which are M1A, talk about category, which is chronic gout. After the dot, the first character says 3, which means renal impairment. The next one talks about the location, which is shoulder. And the next one talks about the laterality, which is the left shoulder or the right shoulder. So it says 2, which means left shoulder. And the last description is 0, which says without tophus. If tophus was present, it would have become 1. Now, this whole long description is completely captured by ICD-10. But in ICD-9 CM, we only could call it 274.02, which indicates only gouty arthropathy. So, all this description about left shoulder due to kidney impairment or renal impairment and with or without tophus would have been lost if we are coding this disease in ICD-9. Moving ahead, let us see the comparison of ICD-9 and 10 from mapping perspective. So as we see, there are certain situations where there is one-to-one mapping, as we talked about. So it's in 70% cases. So ICD-9 CM, Tietze syndrome is 733.6, and in ICD-10 CM, it is M94.0. This is a clear-cut case of one-to-one mapping. But then there are situations which are not one-to-one mapping, which are, I'm showing you an example of 1-to-3 mapping. In ICD-9 CM, the spotting complication during pregnancy was given only one code. But in ICD-10 CM, it has been divided into 3 codes depending upon the semester of the pregnancy. Another example we'll see is 1-to-16 mapping. The poisoning by hormones and synthetic substitutes in ICD-9 was having only one code. But in ICD-10 CM, it has got 16 different codes. And this goes on so much that there is a situation where you can even have 1 to 1600 mapping. So in the remaining 30% where the one-to-one mapping is not existing, there needs to be a manual intervention to convert the ICD-9 code to ICD-10. And this is usually the cause of concern as well. I'll quickly show you some examples here. So one example here I'm showing is of cancer. The neoplasm, as you can see, is a cancer. And this is an ICD-9-CM example. So you can see 140, first line, 140.0 to 149.9. These are examples of malignant cancer of lip, oral cavity and pharynx. Now, just keep your eyes on this because what we are describing here is cancer of lip, oral cavity and pharynx. If we go one level deeper into the lip, oral cavity and pharynx, then 140.0 to 140.9, 141.0 to 141.9. So you can see that by the virtue of numbers, you can just about code 9 to 10 diseases of each particular anatomy. So there is a limitation on the numbers of diagnoses that can fit under a particular code. Moving ahead, you will also see that after 141, we are only seeing the cancer of the tongue here, and 141.0 to 141.9. So once again, there is a limitation on the number of diagnoses we can have here. Now let us see some different examples. This is an ICD-10 code. So first thing you will notice here is that the cancers have not been coded as per the site, the anatomic site like 9cm, but the cancers here have been coded as per their behavior. So you see C00 to C96 is a malignant neoplasm. So whether the cancer is in the brain or lungs or prostate, it doesn't matter. If it is malignant, which is like the bad kind of cancer, then it is listed here. If it is benign, it is listed under D. So this is the biggest difference between coding here, that the cancer has been clubbed as per their behavior. If we go one level deeper, once again you can see that C00.0 to C78.8, and here we are covering all various types of malignant neoplasms. So this kind of makes coding more logical and easy because it is based on the behavior instead of basing it on the anatomy. However, one level deeper when we go, it will come back to anatomical. So once again, now at the third level, we are seeing C00 to C14.8, and this is again the malignant neoplasm of lip, oral cavity and pharynx. So we are at the same point as ICD-9 here, but you see we have reached that point after digging two levels. So already two higher levels of information is being captured in ICD-10. So there are several examples which we can talk about. By and large, I have come to the end of my presentation here. If you ever have any code and you quickly want to confirm what that code stands for, you can go to this website called findacode.com, and there's a /search.php. And on this particular website, you can put in any particular ICD-9 or ICD-10 code, depending on whichever catalog you choose. And you will be shown the disease and vice versa. And you can also find out the equivalence mapping. So with this, I have come to the end of this PowerPoint presentation.